What is one word you would use to describe choices?
Freedom.
Hope.
Revolutionary.
Resilience.
Compassion.
Hope.
Onward.
Empowerment.
Yeah, I mean, choices started from the community. There was a group of feminists that got together and said, we need a clinic that's going to take care of people now that Roe was decided by the Supreme Court, abortion was legal in all 50 states, and that took tens and hundreds of people to get that done.
You know, Choices is about innovation. Us being the first nonprofit birth center and abortion provider in the same space is revolutionary. I remember when Rebecca Terrell approached me to start midwifery services at Choices, and we talked about this new model of care that really centered the patients and recognized that they were caring for people just at different points in their reproductive lifespan.
They're the same patients that we're caring for, regardless of whether they need birthing services or wellness, birth control, if they're ready to parent, if they're not ready to parent, if they need abortion care. It just makes sense for all of these services to be in one location. To be able to provide that through a person's lifespan, I think is really very important.
We are trailblazers. We are a birth center that nobody else has had ever. Like, we are doing some powerful things to change the community. So
It's important. Choices does work that other people don't do, and they've been doing that work for 50 years.
50 years to me means a lot of good fighting.
It means that we have kept going when things were really hard.
No matter Dobbs, no matter Roe v. Wade, no matter the Tennessee State Department, we will be here and we will always be going onward.
The first word that comes to mind when I think of choices is community. Really feel that whether you're a staff here or you're a patient coming in, I get a lot of feedback from patients, saying that they felt seen here, cared for here, or over the phone. I get a lot of patients who will say that they were referred here by a friend or family member. So I think that speaks volumes to, the care that we provide at Choices.
Still people from the community that are working at our clinic in Memphis, and our clinic in Carbondale is staffed by people that live in Carbondale. When you're from the community, you can understand what the community needs and how to support them and connect them to resources.
I feel like it's a safe haven for marginalized communities. I love that Choices has always been at the forefront of reproductive justice, especially what that looks like for women of color, and standing up and being supportive of the LGBTQ community.
The entire organization, everyone that works here, just the compassion that we have for community, for individuals who are struggling to access the kind of care that we provide. When people walk in the doors, we meet them with open arms and really meet them where they are. And I think that's a beautiful thing.
Choices is great at continuing to push our clinic, our patients, our staff to be what our community needs. And there's always room to go on.
I don't know exactly what the next 50 years look like, but I know that Choices will continue to provide the care that our community needs. And I'm really excited to see where that takes us.
I just absolutely love Choices, and I'm happy for the 50 years.
Wrong way. Other way. You just said the same.
In the next 50 years, I would love to see Choices vending machines throughout the city.
You just said the same.
Oh.
No?
You've been here the longest.
I ain't been here that long.
5 years versus my 1.5.
But what do you see?
This is all gonna get cut out, right?
Maybe.
Okay.
Yeah, I want to see put a quarter in, get a mifepristone out.
No.
You could just hold for 2 seconds, and then
I want reproductive health to be as accessible and affordable as vending machines. So that's my dream for the future.
Oh, because
I'm trying to look at you. Okay.
and that's a cut, yeah.